Hello, my name is Joe Scopletti, and for those of you who don't know, I'm the President and CEO of the Guthrie Clinic. And today I want to update you on the COVID-19 situation, both in our region and in our organization. It's a bittersweet message. For the last several weeks, our nation and our organization has been preparing for and managing our way through this COVID-19 crisis. And there is a tremendous amount that I am proud of and grateful for. People all across the region and within our organization have contributed tremendous energy and enthusiasm in preparing and managing our way through this. But the COVID-19 epidemic has forced us to make changes and make those changes at a pace that has been never seen before. And many of those decisions have been made in truly uncharted waters. Our leadership team is working every day to make the best decisions, the right decisions, for our patients, our community, our Guthrie colleagues, and our organization. These are very challenging times. In preparation for a surge of possible COVID-19 patients, Guthrie made necessary changes to operations to reduce social contact and preserve resources, staff, and supplies. Patient traffic to our Guthrie campuses was successfully minimized within a matter of days through the postponement of many non-essential services. Our employees rose to the occasion to meet these challenges, showing grace and bravery. As a result, the spread of the virus has been slower in our areas than in other regions of the country. If we've played a small part in this, we are very grateful. For the cooperation we've received from our staff and our community, we are extremely thankful. Today, as a result of these actions, we remain prepared. Guthrie's 5 hospitals are at 50% capacity, and only a small number of patients require one of our system's 56 ventilators. That is very good news. Yet these decisions have had a significant impact on Guthrie's business. With the postponement of surgeries and clinic visits, our revenue has fallen significantly. By the end of March, Guthrie has experienced significant reductions in patient volumes, including a 60% decrease in our ambulatory office visits, a 75% decrease in surgery volume, and simultaneously we saw a decline in emergency department visits and admissions to the hospital by about 50%. To address these changes in volumes and the resultant revenue losses, Guthrie is today announcing significant changes to the expense lines for salaries. These changes are graded based on the position. The CEO position will have a reduction in salary of 30%, and the executive vice presidents will have a reduction of 20%. Our physician leaders, other vice presidents, and all of our physicians will have between a 10 and 20% reduction in their salaries, dependent upon their position in the organization. Temporary furloughs will also affect many Guthrie employees who have less work due to closure of offices, reduction or cancellations of office visits, procedures, and postponement of surgeries. These furloughs will also affect support services and shared services, who provide the backup for many of our clinical operations. The majority of our employees will have no change in their status, as they will be working in their current role or working from home or redeployed into other positions throughout the organization. Guthrie is also suspending hiring for any positions not directly needed for patient care and will be delaying capital projects or reducing contractual services in an effort to avoid or reduce costs. Furloughed employees will retain seniority and years of service and will continue to have benefits, including health care insurance, available during this time. Employees who have been furloughed are also eligible to apply for financial assistance through the Mark Stensager Human Services Fund. This fund has been around for many years and has been used in prior emergencies and crises. It is supported by the contributions of both our employees, managers, and our community. The decisions we've made this week are tough decisions, but we've made them to prepare us for the current and future environment. We need to be ready to manage the COVID-19 patients that do come, but we also need to prepare the organization to be stronger and more secure in the months and years to come ahead of us. As we move through the next few weeks, we will start to move patients back into their normal clinical care. This will be determined by our government's rules, regulations, and guidance, and also what we see as necessary care for our patients. Together we will get through this. We remain focused on our 3 initial ideals. maintain a safe environment for our patients, maintain that safe environment for our staff, and be prepared to provide our community for the necessary medical services both now and in the future. Thank you for your help and support.